Hello, everybody. Thank you for being here. Thank you for inviting me to this session of ACM Meeting today. And today is ICU day, by the way, and I'm in orange as well. We are all in orange. So, I am going to talk about health informatics today, especially because we have recently initiated and established and offered health informatics program in our Department of Informatics and Computer Science, College of Business at Idaho State University. So I thought that it's a good opportunity to just talk about health informatics in general and the health informatics discipline, and also to talk about the jobs, like job types and job settings related to this emerging discipline. So I am going to start this presentation with just talking about health information technology in general. Why do we need health information technology? Then I will distinguish between physician-centered health IT and patient-centered health IT. Then I will just start talking about health informatics as a broader concept compared to health IT. And finally, I will be discussing health informatics, job types, and settings or workplaces. So let me start with just like a story. 10 years ago or 15 years ago, if you wanted to visit a doctor, like primary care physician or your family doctor or ER, you would go there and you visit the doctor and you would probably do some x-ray because you have some symptoms like headache or dizziness or something like that. So you'll do some, x-rays or probably MRI, and you fill prescription, and after that you're good to go and you go home. Suppose that 1 month after that you want to visit another doctor, another healthcare organization like hospital or clinic. What if they do not have the information, the medical record about you, the medical record that is already stored somewhere else in some other organization, some other hospital? So they may ask you to do the tests or x-ray or MRI and all these kind of things again. That's not good because it's kind of redundant and it's kind of duplication and it's not efficient in terms of time, money, and quality of care. That's why actually hospitals, clinics, and other healthcare providers started to adopt health IT, health information technology, to just manage medical records, patient medical records, in a systematic way, to organize it and manage medical records and to share it with other people, other physicians, other doctors. So this was just to show you how important healthcare information technology is, and so I think I'm going to plug my.
There's one power up there.
Yeah, there's one up there now.
Okay, cool. Thank you. So the issues with traditional healthcare systems were just most of the time test results and patient records were not available during an appointment, and doctors ordered the tests that had already been done, and medical records were not shared effectively with other doctors, other specialists, and other primary care physicians. So again, because of that, hospitals, clinics, and other healthcare providers started to adopt healthcare information technology and started to invest a lot of money to just move or shift from paper-based medical records to computerized or digital medical records, which is kind of more efficient and effective. It's easier to manage, organize, and make structure for medical records and to share medical records. So that's the reason that healthcare providers are spending a lot of money in this industry. By industry, I mean healthcare information technology. They want to just adopt and implement healthcare information technology. The results of a survey showed that like 25% or 30% of hospitals' capital project budget these days are spent on healthcare information technology, and specifically electronic medical records, sometimes also called electronic health records. EHR is kind of a wider, more comprehensive term for electronic medical record. I'll be discussing about it. So EHR vendors are different from like Epic, Cerner, Allscripts, and all these popular vendors are actually making money by developing, implementing, and supporting their systems in healthcare organizations, hospitals, and clinics. Physicians and healthcare providers actually perceive these benefits in terms of clinical benefits, financial benefits, and even operational benefits. I'm not sure if it's readable here. It says that physicians think that their EHR makes records more readily available at the point of care. From 91 to 94% of physicians think in that way. My EHR allows me to deliver better patient care, 69 to 75%. And my EHR enhances data confidentiality, 60 to 7%. In terms of money and financial benefits, my practice saves on costs associated with managing and storing paper records. So it's good. It's good to have these kind of systems. It's good for who? It's good for healthcare organizations, for physicians, and for patients. It enhances the quality of care eventually. All right, now each healthcare organization has started to adopt and implement a system in their setting, whether it's inpatient or outpatient setting, whether it's a clinic or a hospital. They have a system. Okay? Now, what if I go from one hospital to another hospital, like from here in Pocatello, and I just visit another doctor in a hospital in Boise? Again, although the hospital, like Portland Hospital here, has their own electronic medical record, but still that information is not shared with other hospitals in other systems, other cities. That's why third-party organizations called Health Information Exchange have come into existence. To do what? To make connection between electronic medical records and to make connection between these isolated medical records in different hospital systems. So Health Information Exchange, or HIE, is a kind of term that is being used these days, and it just combines the data, the medical record from hospitals, physician offices, labs, imaging centers, public health, and so on and so forth. And they want to share it with the right person at the right time and in the right place. Okay? Interestingly, health information exchange organizations are usually based on states. It means that each state has its own health information exchange. Indiana Health Information Exchange is probably the most popular, the most successful health information exchange organization. They have more than 25,000 hospitals connected to each other. And not just hospitals, providers, and all other kind of organizations or providers. And let me show you. State of Idaho. What is that?
We're a blue state.
Blue screen go.
For the first time in history.
No one can hear you scream.
Okay. So, in I think 2009 or 2010, state of Idaho has also started on this initiative, Health Information Exchange. So this is called Idaho Health Data Exchange, and it's a non-for-profit organization. We just make connections between different hospitals. So they are providing different services like Idaho Health Data Exchange launches image exchange with St. Alphonsus Health System. And they say that during December 2014, 664,000 cases were reported in terms of participant usage of records for patient care. So This means something. This means that healthcare organizations are not only establishing their own medical record system, but also joining these kind of health information exchange system to share medical records with other healthcare organizations. And a couple of days ago, I was reading an article on Information Week, and it said that these health information exchange organizations need to also be connected to each other at the national level so that we can share all the medical records at this level. So it would be great. It would be an ideal situation. And these are kind of opportunities for you guys, for those who want to work in this industry. It's a kind of growing industry, and every day you see that there are new opportunities. Okay? So, going back to the presentation. All right, so all these systems, including electronic medical records, EHR, health information exchange, who are the users? Who are the main users of these systems? The main users are physicians, doctors, nurses. But what if we implement, what if we adopt systems or promote systems that are used by patients themselves? That's called patient-centered care. Okay? Patient-centered health IT are all those technologies in which patients play a major role. Major role in terms of providing information, adding information to the system, and so on and so forth. Like patient portals. These days, hospitals are also providing patient portals for their patients who are their clients to just use the information to update their information, to request an appointment, to refill a medication, request a referral, and so on and so forth. So on this side, patients are the main users. Personal health records. I'm not sure if you are familiar with like Microsoft Health Vault. That's a system that you can install on your cell phone or on your desktop, and you can keep track of your healthcare and wellness issues like medications, symptoms. You can add information, you can add data about yourself. These are called PHR, personal health records. And again, the ideal situation is when you make connection between PHR and all the EMRs and EHRs in the organization, healthcare organization. It would be great. They could make something available to you, and you could provide some information to them. And this will be kind of integrated healthcare information system. The next one is just health social media platform, something that I've been working on for years, research-wise. So some websites like dailystrength.org that people go online, join these websites and engage in online discussions and try to share their experience, their knowledge, and try to help each other. It's a kind of social support network. Some organizations, some healthcare organizations like Mayo Clinic has started to implement and provide their own health social media platform for their patients. The next one, mobile applications. Just some applications that, again, you can use them as personal health records, or they can be just social media platforms, but they are anyway kind of mobile applications. And like this one that you can add blood pressure, and you can keep track of your blood pressure over time. So these are all patient-centered because users are patients. And the last one, probably the most interesting one, wearable technologies, wearable health technologies, something that you put on your body, something that you attach to yourself, attach to your wrist, to do what? To just measure your heart rate, or for fitness tracking, or for step counts, and so on and so forth. So this information can be collected through these devices. They can be stored on your computer, and they can be sent automatically to your physician. That would be great because the information is just flowing, and it can improve the quality of care eventually. So these were basically two types of health IT, physician-centered and patient-centered. Now, something that I always talk and I always emphasize in my classes is that technology is not the only aspect of information systems. There are some other aspects. Like what? Like procedures, policies, regulations, like helping people use these systems, the soft side of technology. the soft side of information system, actually. So having technology by itself is not enough. That's why a broader term named health informatics was introduced. Health informatics includes not only the technology side, which is software, hardware, database, and telecommunication networks, but also health information management, including procedures, policies, guidelines, administration, and compliance with all of those procedures and policies. So health informatics is at the intersection of these two areas. And that's why it's becoming more and more popular and important, because knowing technology is not enough, and probably people need to know about healthcare guidelines and policies and procedures. So, in order to adopt and implement these kind of systems, these kind of information systems, what do we need to do? First, analysis and design, development, implementation, and maintenance of EHR or any other system. Who will do this? Most likely, IT vendors like Epic will analyze and develop these systems, and they will come and implement it in your organization. If your organization is just healthcare organization like hospital or clinic. And it's not probably efficient for hospitals to have in-house IT department to develop their system. It's most of the time it's probably more efficient for them to just outsource the system or just buy the package. So, database administration and system administration, business process re-engineering and management, that is very important. Because when you are introducing a new system, a big information technology in your organization, you need to match your business processes, your procedures, in order to, make them aligned, make an alignment between these processes and your system. So change management, people need to use a new system. They used to use just paper-based medical records. Now they want to use electronic medical records. This is a change, and somebody should manage this change. And again, data and business process migration from legacy system to the new system takes time, it's complicated, and it needs a management. It needs a project manager. Training, security and privacy protection, and regulations and policy. These are different aspects that should be considered when we are talking about health informatics. So that's why there is so much need for experts in health informatics, because there are different tasks associated with health informatics. Some people would like to work on the technology side, design, implementation, and just adoption in organization. Some people would like to work in the database administration or system administration. Some other people are more interested in the business side, operations management, business process management, and change management. So, in order to handle these tasks, health informatics experts need to gain knowledge, need to have an understanding of different sides of science, or different forms of knowledge, including core information technology, like what? Like database, software design, software development, or telecommunication and networking. Core business administration skills, like finance, accounting, marketing, or HR. Healthcare administration, like regulations, policies, procedures in healthcare environment. And finally, statistics and data analytics, to just analyze data that is collected and stored somewhere. You can analyze data and extract meaningful knowledge for the future use. Okay? So, most of the schools that offer health informatics programs try to focus on some side of this health informatics ecosystem, or health informatics science map, skills map. Fortunately, in our program, we focus on all different aspects of health informatics, and we try to make our students prepared for any of these areas. One may ask, what are the types of jobs for health informatics? Chief Information Technology Officer and Health Informatics Director are probably two most popular ones at the managerial and director level these days. Hospitals are just hiring Health Informatics Director to just manage their, change management, to do their change management and to help them migrate or move from legacy system to their new system. Project manager, workflow redesigner, and change manager. So these are all based on the skills that I just talked about. Clinical solutions, consultant, analyst, trainer, health information exchange coordinator. These are working with HIE organizations like the one in Idaho. So they need some coordinators in different hospitals to coordinate, the health information exchange activities. Systems and business analyst, software designer, developer, engineer, database assistant, administrator. These are different classes of health informatics jobs. And finally, these two are more related to data analytics and data analysis. Data warehouse designer, programming analyst, and data analyst and scientist. So these are more related to data analytics and statistics. These are more related to managerial side, business side, and healthcare administration. And some parts, like here, are more related to technical aspects of health informatics. So this is just a brief kind of description of health informatics director job. This is a job that is, recently, it has become popular recently, and still it's not very well defined. However, there are some, duties already defined for this job, like championing the new system to doctors and other medical staff, addressing problems with the system raised by doctors, implementing processes, and continually reviewing the latest technologies. These are some duties for health information director. Again, a couple of days ago, I was looking at different hospitals' websites, and I saw that there are different career opportunities, and several of them were just clinical information director or health information director or something like that. So these are the jobs that can be imagined for this class of jobs. So median salary based on a survey conducted by AHIMA, 2010. It was actually surveyed from almost or nearly 11,000 IT professionals. Median salary for Bachelor of Science, it's not very new, it's 2010, but still it gives you an idea. Like PhD degrees, Bachelor of Science, 84,000, and master's degree, those with master's degree, $99,000 was the median salary for those who are working as health informatics director. However, it doesn't mean that those who graduate or those who major in this area will right away get a medical informatics director job and will get these salaries. Probably you need a couple of years, those who will be graduating in this area. A couple of years getting experience. However, the good news is the opportunity for promotion. You can get better and better jobs just in a few years. That's the great news, because in other jobs that might not be the case. Okay? So, job settings. Where should we work? Where are the workplaces? The prominent one is just healthcare providers, healthcare organizations like clinics, hospitals, and physicians' offices to manage their EMR, to help them implement EMR, to help them adopt and utilize this system effectively. Health IT vendors, probably those who are more interested in the technical side, like software development, software design, application development, website development, patient portal development, mobile application development. Those are people who would probably end up working in Epic, Meditech, Cerner, and other health IT vendors. Health information exchange organizations, like the one in Idaho, or Indiana, or Utah, or Pennsylvania, they all have their own health information exchange organization. Insurance company, like Blue Cross of Idaho, healthcare and technology consulting firms. Probably the highest salaries are in these organizations when you are working as a consultant to just help different healthcare organizations adopt their system. government and regulatory agencies like Department of Health and Human Services that enforce HIPAA, for example. HIPAA is the privacy law or regulations for patients. National Institute of Health, NIH, or American Health Information Management Association. These are different organizations, government organizations that, graduates may find decent jobs related to health informatics. Research and development institutes, finally. Universities and pharmaceutical companies can also take advantage of your knowledge as an expert in health informatics. The point about experts in health informatics is that they know different sides of technology, not just the information technology itself, but also about how to deal with people, how to deal with procedures and processes, and how to do statistical analysis on different data. That's the main point, that there is such a huge need for these expertise these days. And compensation survey 2013 by HIMSS. HIMSS is a major organization that conducts surveys. These are more managerial positions related to health informatics. Executive management 189, senior management 161, associate staff 137, department head 109, management 97, and staff $86,000 is the average salary in 2013 for health informatics experts in these positions. Okay. So the good, and also the good point is about the increase. Average increase is like 4 or 5 or 6%. That means something. That means they need you. They need people to take care of this kind of stuff or technical stuff in the organization. And salary increase based on the same survey, the results of the same survey shows that over 2/3 of survey respondents indicated that they received a salary increase. So 2/3 of them got a salary increase, and the increase was on average 4%, 4.16%. Okay, and the bonuses, like half of them get bonuses, and the bonus was 3% or 4% of the salary. This shows that this is a kind of attractive area to work on. Okay. An average salary by year in position. Recent graduates may even get up to $130,000. Okay, 1 to 4 years, 5 to 9 years, and as you can see, this is even much higher than probably those who have been in the industry for 5 to 9 years. What does it mean? It means that probably these graduates are fresh and they have fresh knowledge on health informatics, information technology, processes, healthcare system. And there is such a huge growing need for graduates in health informatics area. And finally, this is the last one, the last part of the results that showed that what kind of workplaces, what kind of healthcare settings or job settings are paying more to people. Consulting firms are on the top, like $141,000. After that, software company, standalone hospital, the average salary is $114,000. And then hospital as part of a multi-hospital system, 111, and so on and so forth. This is also a payer. Payer is just the insurance companies. So, based on this, we actually started our health informatics program in our department. And before that, I would like to show you something. This is Special Interest Group of Health website on Association for Information System, AIS. AIS is like ACM. These are two major organizations in computer science and information systems. So this is AIS website, and this is Special Interest Group on Health. And it has listed the health IS programs, or just health informatics programs. And we are among the probably 25 or 30 programs with health informatics. Iowa State University, we are proud to be one of them, along with other schools like Georgia State University or Indiana University or University of Toronto, Canada, and so on and so forth. So we offer Bachelor of Business Administration in Health Informatics, and if you are interested, or if any other student is interested, a very good source of information is Dr. Parker's website. Source of information about our major, our department, and course flow, semester plan. These are the courses that we offer. Some of them are related to technology, like programming, software analysis and design, networking and database. Some of them are focused on health informatics itself, like health informatics and health information assurance. And some of them, like project management, related to business side, aligned with all other principles of finance and marketing and all other courses that students need to take. And finally, some courses like U.S. health system and healthcare operations and quality to learn more about procedures, policies, and regulations related to healthcare. So I think this is and by the way, there is one healthcare workflow process analysis and management that I think will be offered, and Dr. Rosen will be teaching them. Am I right?
Yes.
Great. So yeah, this was just the presentation on the whole concept of health informatics, what it is, and how we can just have a job in this area, in this discipline, and what are the opportunities. And in order to get those opportunities, there is another opportunity to just major in health informatics or Bachelor of Business Administration in Health Informatics in our department. So, yeah, that was what I was trying to explain. If Caroline or Kevin, if you have any other points, comments to add to this presentation, that would be great.
One thing that I'll say, when Dr. Ottaway and I were working on this particular major and looking for faculty to staff these positions, you guys that have had me in class know how picky I am. Picky, picky, picky. I think we hired the best that are out there. I think we have got a fantastic faculty. I look at other programs, I look at what we have to offer, and I think we have got a great, great program. I really do. I believe that. And I believe these guys are going to be fantastic. When I'm gone and retired, if I ever retire before I drop dead, these guys are going to do great things with this program. I am convinced of that. So you guys are in good hands, and you have great opportunities. You really do. Angela Byington, the graduate who came and talked to us a while ago, is coming back to get her MBA, and then she's going to work on her Master of Science in Health Informatics. She's staying in the area so that she can continue her ties to ISU. She has that much faith in the program. She's given up money to stay in the area. So, you're talking about your average salaries, and she's not getting paid that much in Boise.
Yeah.
But we've got a great program. These guys have done a great job. I mean, they started working on the curriculum before they even got here. We started having them give us input on what the courses should, what the curriculum should cover. And I'm really excited about this. We need to get out and sell this. We need to convince students to major in this, because this is such a great opportunity for people. It really is.
And I believe the outlook for this program is just will be one of the, I can say that one of the most successful and most popular health informatics departments or programs, or bachelor's programs, and also master's program. We want to talk about the master's program also.
We have a proposal for a Master of Science in Health Informatics. Unfortunately, it has stalled at the administrative level here at ISU, not because they don't like it, but because the provost has been out of town so much. And so it's kind of stalled at the upper levels, but once it gets through here, which I have no doubt that it will move on to the state board, and we have to have state board approval. I'd originally heard that it will be available in fall of 2015, but then the last I heard was, given the delays, it'll probably be fall of 2016, which really disappoints me. But incidentally, talking about, you mentioned the opportunity to get promotions, et cetera, et cetera. I know Angela has periodically mentioned me in emails, there are headhunters out there trying to hire her. And she's talking about having to turn down offers of $30,000 salary increases. Well, that's really hard to turn down. Now, one of her deals is she's got family and she doesn't want to keep uprooting family, moving. But $30,000, that's a lot of money to say, no, I'll stay in Boise. So there are a lot of opportunities out there. And that master's degree is really going to open things up for us.
Yeah.
If you're just working on your CS degree or your CIS degree or your business informatics degree, think about sticking around and working on that Master of Science in Health Informatics. That's a good deal.
And I think one of the good points about our department and our faculty, like Karoli and Shankar, is that we are all kind of multidisciplinary from technical side and business side, so we can provide help and support for our students to be successful. So, any question, any comment, idea on the presentation? On the color of
I like that sweater.
All right, thank you very much.